I would want to start by just congratulating everyone who is here for coming from every angle of the country. So the era of setting up a business starts from there. We are setting up businesses where we live because we think where we live is where we want to do the business. But the reality is that business is where there is business. Business is not where you are living. So we start to make mistakes where we have a lot of providers in areas where there is no demand.
Transfer risks. So risk management, you can transfer risk, you can retain, you can avoid, you can accept it. So insurance is one of the methods of managing risk, so transferring it. So that you can then be able to do and focus on the things that matter to you, like for instance, providing good quality care to your service users. You don't have to worry about what if this happens.
Empower your staff, please. Your staff is the game of your company. Treat your staff well. In order for you to expand and to have a good business, just treat your staff well. Make sure you're constantly delivering, you're constantly training your staff, and you're reviewing your package.
Effectively, when we look at your revenue, COGS, gross profit, overheads, are you in a profit or are you in a loss? If you're in a profit, we then have to pay tax to the taxman. It's 19% up to 25% sliding scale to HMRC, which is paid 9 months and 1 day after your company year end. And really key, in your business name. If you buy a property in your name, it's not a business asset. If you buy a car in your name to reduce the tax that you're paying to HMRC, but you then register the car in your name and the contracts are in your name, that is not a business car. That is a personal car, okay? So for an asset to belong to the business, it needs to be registered to the business.
If you're a new provider, you need to remember this. You will not pass affordability. You need to have at least 30 times the rent in profits that were declared in the previous trading year. So in your last filings, you need to have declared 30 times the rent in profit. So if the rent is £1,000 in your last filings, if you didn't declare £30,000 in rent, your company will not pass affordability.
Social services in Coventry, they're inundated with children coming into care because of the domestic violence in the homes, maternity services, the sexual health. They're saying it's just too much. People come with their stories. Please don't feel sorry for people, because they will always come with their stories, and those are the same people who will report you.
This is not a business like any other business where you think you are going there to make money. If you go into this business thinking you are going to make money, you'll be disappointed. It's always advisable that you recruit experienced staff in supported accommodation. Sometimes it's better for you to start supported accommodation, which is a very good advice, because that one will give you a lot of experience before you go into the big fish of it all, the children's residential homes.
The business that we are supposed to be running, it's a business that survives on customers. If we don't have external customers out there, we still have internal customers. For as long as we employ somebody, that person is our customer. Strategic customer service. And when we're talking about customer service, we are not talking about the reception level. We are talking about the director level, strategic customer service.
Leadership is fine. You need your really good staff, and that's quite difficult. But the main thing, and he mentioned it, was compassion. But the main quality that we all need in any care situation is that compassion. And I'm sure, looking around here, I'm sure everybody here has it. I know in my nursing home, all the carers had it. And so my message is always nurture the care staff and nurture your clients, in my case the older people, which was sometimes not easy. Sometimes people are very difficult and you feel like saying, oh, I can't do it anymore. But we always carry on, and I think that's the main message, that kindness, compassion, and also slightly fulfilling the regulations.
For honest communication. There's freedom before speaking. There's freedom during speaking. There's freedom after speaking. You don't get your shifts reduced by the team in the office because you're spoken up. You as a director, you are not aware of your clients, of your staff. You don't even remember their names. If you don't know your staff, you don't know their names, how are you going to influence them or inspire them?
HMRC will want their money. It's public funds that is owed to them. You're supposed to be paying your taxes. So do it. Do it in the fashion that you should. Speak with your accountants and get your accounts in order. You don't want to be working this hard, getting a company that's churning 10 million only for HMRC to wind you up, and then it's all gone.
So a lot of carers are doing tasks, but they miss the person. They miss the person. That's why sometimes you go, you work so hard with a client, you do everything, you say they've done 100%, the 100% is of the 40%. The 60% you have clearly missed. And that's the very same person who phones the office, I don't want so and so. And you ask the carer, they don't want you. And the carer is saying, they hate me. We need to have training, even on things that we think are so simple and common. Common sense is not common.
And obviously you've got other costs in relation to the property that you're going to secure. Is there planning permission that's needed there, or does it already have the adequate planning permission? Any renovations you're going to have to make to the home. But also, even when you do get registered, it doesn't mean that next day you're going to have a child in the house. It won't be like that. You might wait a month, 2 months.
But R&D actually works, and if you speak to your accountant, they will actually claim money for you for digital grants. I personally got some money. I don't want to say how much, but I got it through my accountant. And trainers, it's my highest selling program at the moment. Everybody wants to become an assessor because care certificate has been abolished, as you all know, and to train in the new qualification you need to be an assessor. So bring that money, we work together.